Is the pain in your back really all about the back, or could it be something else? And reality is that if you come at it from a biomedical reductionistic approach, you'll be thinking that it's all about the back and just about the structure. But we're moving away from that. The change and the advancement in our understanding of pain is that we have to embrace a whole body approach when it comes to assessing, managing, and helping overcome your pain. That is truly the right way forward, because there is so much complexity in trying to treat pain. We now know that there are about 3-4 things that make the whole body approach the only way forward, not just for pain management, but also for most long-term conditions itself, whether that's diabetes, whether that's hypertension, whether that's obesity, whether that's asthma. The principles are more or less the same. Why do I say that? Well, first of all, we know that medications and the usual injections or surgeries for pain do not work all the time. The evidence seems to point that for the right person at the right time, it can make a difference. But unfortunately, that's not the case in most patients. Because medications and interventions, as I've talked about in other videos of mine, are most useful when the pain is of the nociceptive or the neuropathic kind. But if the pain is due to a sensitization of the nervous and immune system, then you are not going to find medications and interventions helpful. The second part that we are aware, now that we understand that pain, especially chronic pain, can be a byproduct of many variables, we are aware of what's called the social determinants of health. We know that for a person's well-being and freedom from pain, what happens in healthcare is only 20% of their well-being. The remaining 80% comes from a complex interaction between the physical environment that you live in, the behaviors that you adopt in looking after yourself, and the socio-economic factors that surround you, your mobility, your economic situation, your work, your social support systems. All of these are going to be responsible in how sensitized your nervous and immune system becomes over time. So the reality is that when patients come with a case of low back pain to me in my clinic, I can't just stop at only the lower back. I would have to find out about the whole person, find out a more comprehensive picture, and that means that taking a trauma-informed, person-centered approach is a fundamental starting point. It always has to be about the whole person. When you then use that effectively, understanding the root cause becomes easier, and then you can bring in all the elements of lifestyle medicine, the 6 pillars of lifestyle medicine, whether that means reducing the use of harmful substances, whether that means attention to sleep, attention to nutrition, attention to good connection and healthy relationships, paying attention to physical activity. But when you bring in all these pillars, understanding the root cause medicine, adopting a person-centered trauma approach, that is a truly integrative package and a whole person approach for pain management. I'd love to hear your comments. Keep them coming. Thank you for watching this video, and I'll see you in the next one. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.